Have you ever been told you'll be on medication for life? What if I told you that's not always true, and that the real solution might be on your plate, not in a pill bottle? Welcome to the truth about deprescription, where thousands are reducing or even eliminating medications simply by changing the way they eat. Hi, I'm Mark Bates, a metabolic health coach. Today, we will unpack Dr. Sarah Hallberg's groundbreaking approach to safely getting people off medications through low-carbohydrate nutrition. Stick around to learn which drugs should be reduced first, why diet changes often work faster than doctors expect, and how patients are regaining control over their health, sometimes in just days. The myth of medication for life. Most people think chronic diseases like type 2 diabetes come with a lifelong sentence of medication. But Dr. Hallberg challenged that head-on. She argued that our healthcare system sees optimization as adding more pills. True optimization involves patients reversing disease, losing weight, gaining energy, and no longer needing drugs. One study from her team showed rapid medication reductions, sometimes within just 10 weeks of switching to a low-carb diet. That's not theoretical, that's clinical reality. Deprescription, a new definition. In medicine, deprescription is usually reserved for the elderly with too many meds. But Dr. Hallberg proposed something revolutionary. A second definition. I don't need it anymore. Imagine that. A patient changes their diet, their blood sugar plummets, and suddenly they don't need insulin. But instead of celebrating, they're often told by their doctor, "You can't stop your insulin." That needs to change. And it starts with the education of patients and doctors. Which meds go first? And why Dr. Hallberg emphasized deprescription must be monitored closely. It's fast, but not casual. She used the term DMOX, diabetes meds of concern. These include insulin, sulfonylureas, and SGLT2 inhibitors. When patients cut carbs, glucose drops fast, and these medications can cause dangerous hypoglycemia if not adjusted. So what's the general order? Prandial insulin, often gone within days. SGLT2 inhibitors, pulled even before insulin due to risk of euglycemic DKA. Sulfonylureas, high risk of lows. Blood pressure meds, reduced more slowly but still significantly. And yes, some patients even get off Humira, GERD meds, and more. Just by changing their food. Real-world example analogy. Think of medications like scaffolding. You need support when a building, your body, is being repaired. But if the structure strengthens, do you leave the scaffolding up forever? Low-carb diets provide the raw materials to rebuild your metabolic house. And once that structure is strong, the drugs, like scaffolding, can come down. Core takeaways. Takeaway number 1. Low-carb diets can dramatically and rapidly lower blood sugar before weight loss even occurs. Takeaway number 2. Medications must be deprescribed with intention, especially DMOCs, to avoid hypoglycemia and side effects. Takeaway number 3. Patients can and should lead the way in this transformation. But doctors must also be educated. Share this video if you or someone you love is stuck on the medication merry-go-round. Let them know that food can be medicine. Like this video if you believe we need a better way. Subscribe for more insights on ketogenic and carnivore nutrition, because you can take back your health. And it starts with your fork.